Warning today from the head of the Canadian Medical Association. In testimony before a Senate committee in Ottawa, Dr. Sandy Buckman saying the provinces are gambling by reopening. Buckman says physical fatigue, burnout, a lack of enough protective equipment is causing the system to break down. He also says if there's a surge of COVID-19 in the fall, hospitals will be ill prepared to handle a second wave. He's also pushing for increased testing and contact tracing. The association represents more than 70,000 doctors nationwide. Evan Solomon is standing by in Ottawa, the host of Power Play, for more on this. A pretty serious warning here for Canada's provincial governments from the CMA.
Yeah, and I spoke to Dr. Sandy Buckman for a long time about this. And I said, what's going on? He said, look, let's face reality. The reality is we lack contact tracing. He told me we need an army of contact tracers. He said, I don't know why they're not doing that. We lack the proper testing. We have barely hit peak testing in key provinces, and I say key just from a population point of view, like Ontario, where the goal is 16,000 daily tests. They've done 10. So he's saying we don't have that. And the one that surprised me most, Todd, was the lack of PPE for frontline workers. After everything we've heard, anybody can have it. He said, the government keeps saying, we've got supplies, we're delivering it, I know they're working hard. He said, you talk to frontline workers, and they say we barely have enough. And if we experience another surge or a second wave, we will be overwhelmed. And then I asked him, well, talk about this second wave. People are already talking about reopening. Are we reopening too quickly? And he said, candidly, yes, the country is reopening too quickly because he said we should not be reopening until we've got contact tracing, testing, and PPE. But I said, well, a lot of people say we've looked at the hospitals, all the fear in the first wave, and our hospitals weren't overwhelmed. And he said, well, it's hard to prove the negative. We're glad they weren't overwhelmed. We had massive amounts of social isolation. But he said, if the second wave hits, and they usually do hit, we're just literally not ready. So it was a sobering reality check on the impatience collectively that we all have to get the economy back on track and get out of our houses.
Yeah, and as you know, contact tracing is going to be so important, but you need people to do that. Manpower is key. Any one person, you or me, we could come in contact with dozens of people. You got to track them all down and figure out whether they were possibly exposed or not. And just the question of whether there are enough people out there. I guess right now the answer is no. Will they be in place? And I know the Prime Minister is going to be talking to his provincial counterparts tonight. What are you going to be watching for, Evan? What needs to happen, do you think?
Two things, people and technology. You're 100% right. As Dr. Buckman said, that we need an army of contact tracers. They've got to be trained. They've got to be well protected. They've got to have a centralized data point. But the other thing is, what's the technology? There are an enormous array of technologies to track people for contact tracing. And cell phone, telecom companies may be part of it. There are privacy issues. There are civil liberties issues. There are security issues. So even Dr. Buckman says, look, are we using all the key contact tracing technology? No, but we haven't even had a really good discussion about that. Let me just ask you and our viewers out there, would you be okay if you have your cell phone here and your location is tracked and sent to a medical database? Wait a second, that's an invasion of privacy. Is that right? So the contact tracing, and we got to look at models around the world, is something that we need. But even Dr. Buckman says the manpower, the technology, but more important, the political discussion about how to do it is not even close to where it needs to be for the great reopening, according to him.
Yeah, and he's saying, listen, I'm not trying to alarm people, but, we just need to be sort of like realistic about this here, that, you think about what happened 100 years ago in 1918. I mean, there was a second wave and it was worse than the first wave.
All pandemics have a second wave. And one of the things that Dr. Buckman likes to talk about is the virus doesn't care. You and I are frustrated. All our viewers are, I want to get back to the store. I want to get back to work. My kids want to go to camp. We want to go to school. I want to get out of the house. I want to go to the sports. I want to go to a concert. I want to go to a restaurant. That's all true. And we have flattened the curve to a huge degree through an enormous financial, emotional, physical, social sacrifice. But the virus is still here. And until we know where, until we get better information, better testing, and possibly a vaccine, the virus can spring back. And Dr. Buckman is quite sure that it will spring back, especially because he believes we are opening just faster than we're ready to do. And so he's, again, saying our hospital systems in a second wave could be overwhelmed. So, Paul, I empathize with politicians who have a very difficult task. They need to open, but they got to avoid the second wave. And this is the great dilemma of 2020.